Hello, I'm Gary. Welcome back to FYPC, my channel about my prostate cancer experience, wanting to share stuff with you to help demystify the journey of prostate cancer. Now today I want to talk about the very early stages of testing. If you've got any kind of symptoms and you've been to see your GP, then the chances are that you're going to undergo some pretty simple tests at the beginning. And this is exactly what happened to me, because I went for a routine NHS health check. The doctor said to me, you're in one of the risk categories, you're over 50, so we're going to add something called a PSA test to your routine blood test, and we'll see what kind of results we can get. So there am I thinking, okay, we're having a PSA test, not really sure what that is. So let's have a quick look at it. The PSA test is looking for prostate-specific antigen. And this is a protein that's produced purely by the prostate gland. And the amount that gets produced is dependent on your age to some extent, but also on the health of your prostate. Now, normal for a PSA test is considered to be 3 nanograms of that protein in a milliliter of blood. So 3 is the magic number. And there are lots of ways to think about this PSA test. I want to go straight to the NHS website, if I may, and just make sure that I give you the absolute truth from them. So a raised PSA, according to the NHS, is 3 or above, and it may be a sign of prostate cancer, but not necessarily. A raised PSA can be caused by other things, like an enlarged prostate, like prostatitis, which is an inflammation or an infection of the prostate, or by some kind of infection in your urinary tract. Okay, so raised PSA doesn't necessarily mean a prostate cancer. Now, accuracy is a real problem here with PSA, because when I think about the 9 other tests that I had after the PSA test, then they were being done to me in order to improve the accuracy of the diagnosis. So what the NHS says about the accuracy is this. Research has shown that 3 in 4 men with a raised PSA level will not have cancer. And 1 in 7 men who have got prostate cancer won't have a raised PSA level. So can you see the uncertainty here? It's a little bit more difficult to be sure about what you're seeing when it comes to the prostate-specific antigen test. And then it goes on to talk about the pros and cons of the test. Well, the pros are, I guess, that you be reassured if the test comes back normal. You'd certainly be happy if the PSA test came back and it found early signs of cancer so that you could get treated early rather than not finding out until much later. And it may reduce your risk of dying, of course, if you do have cancer, because you've caught it nice and early. So that's an important thing. There are good reasons to have the PSA test. But there are also a few cons to the PSA test. According to the NHS, it can miss cancer and therefore provide false reassurance. Well, my PSA test was normal, but I've actually got cancer. It could lead to unnecessary worry and unnecessary tests, even when you don't have cancer. And it can't tell the difference between slow-growing cancer and fast-growing cancer, and that's what all the subsequent tests will be about determining. And it may make you worry by finding a very slow-growing cancer that will never really ever cause any problems. So weigh those things up, the positives and negatives of a PSA test. So I had the test and I had the results. It's not 3 or less, it's 10. And I'm sitting in the doctor's office, surgery, and he says to me, okay, so we need to progress. We need to move on to the next step and find out exactly what's going on. First step, I don't know why I did that, but it's appropriate, finger up the bum. So the DRE, the digital rectal examination, doctor snaps on the rubber gloves, puts the lubricant on, you lie on the trolley on your side, and he inserts the finger into your bottom because the prostate is right there. It's right behind the rectal wall, and he's feeling the surface of the prostate in order to see if there are any obvious abnormalities. So I have this done, and he said the next step is for you to go off to the urology department of your local hospital, where they will do an assessment and you'll be referred to have an MRI scan. And obviously the MRI scan will provide an image of your prostate and we can take it from there. And I'll tell you more about that MRI scan experience in other videos on the channel. But just take from this video, the PSA test is early, it's important, it can give you an indication, and certainly if it's at a much higher level than normal, you'd expect then to be referred for other tests. So I hope that's helped you understand what the PSA test is, the blood test, and we'll move on to all the other tests in other videos on the channel. I'll see you soon.